A state of emergency was declared back on March 19th. The government has taken a phased approach to reopening with 100 cases, COVID-19 cases that is, and 11 deaths on record. The Bahamas recently began transitioning to phase 2. Well, if the global pandemic has taught the Minnis administration anything, it's that the Bahamas must improve the resiliency of the public health sector. Ensuring so has led to the government upping its allocation to the national COVID-19 response by $20 million. Deputy Prime Minister and Minister of Finance Peter TURNQUEST adds that the economic support measures in this regard will continue.
We are allocating over $250 million to extend and expand the initiatives we implemented in early March into the first half of the upcoming fiscal year. These measures include $48 million for continued unemployment assistance for persons who remain dislocated, $17 million in increased social welfare spending to provide expanded food assistance through the government's food voucher initiative, as well as to support the expansion of other support programs at the Ministry of Social Services. As a new measure, we will also fund a temporary incremental monthly increase of $50 in the old age pension administered by the National Insurance Board. And this to aid the elderly who may be dependent on other family members that are now jobless because of the pandemic. NIB is working on a rollout date for this program and will communicate with the public when it begins.
Further $20 million in contingency funding has been allocated for public health sector support. TURNQUEST says the money is to ensure there's sufficient funding for ongoing detection, treatment, and mitigation of COVID-19 here in the Bahamas.
This will cover the cost for medical equipment and supplies, ensuring sustainable quarantine facilities if needed, and other measures to make certain that this country is fully equipped to combat the spread of the virus.
Now, besides the expanded allocations to address COVID-19, the 2020-2021 budget will also reflect an increased allocation of $18 million to national health insurance.
Primary care delivery is estimated to cost the government $83.3 million each year. Without significant change to the delivery model, this would escalate to $127.7 million by 2025, an increase of $44.4 million. The integration and streamlining of these separate healthcare delivery systems are essential to ensure better quality care of patients. Therefore, the government is proposing for the National Health Insurance Authority to lead a series of reforms which would effectively and efficiently address the ongoing challenges. Their refocused NHI initiative will require no additional taxation or employee mandate.
Now, TURNQUEST says more importantly, it's to ensure that everyone has consistent access to a family doctor with minimal copay requirements and deductibles. This is expected to save the government approximately $62 million, and that's over the next 5 years.